On behalf of Bella Magazine and IGEA Brain and Spine, good morning. I'm Dr. Adam Litson.
And I'm Dr. David Poulad.
And we're both neurosurgeons from IGEA Brain and Spine, based in New York and New Jersey. This morning we're going to talk about headaches. Headache is pain that usually comes from the scalp. It can come from the covering of the brain or the dura. It can come from the blood vessels within the brain. The two most common variants of headaches include tension headaches and migraines. David, tell us a little bit more about tension headache.
Tension headache is one of the more common type of headaches that patients will experience. They're often relatively benign, but they are painful. They often involve the entire head. They're not usually one-sided. So patients will say, I feel that there's pressure around my entire scalp. Some patients may feel pain in the back of the head or in the back of the neck. It's often a result of stress or overuse, exercise, those types of injuries. This headache often responds to simple over-the-counter medication and tends to do better when patients are relaxed.
So if you're taking ibuprofen around the clock, maybe taking too much, and that's something you probably should talk to your physician about. Another common variant of headaches are migraines. The classic headache is a sudden, severe headache. You just want to go in a dark, quiet room. You're sensitive to light. You have nausea and vomiting. It usually affects women more than men and is generally very easily treated with some medication with your primary care physician. On occasion, you may need to see a headache specialist. There are a lot of different variations of migraine headaches, but they usually are sudden, severe, and they get better, often with sleep. David, tell us a little bit more about the headaches that make us worry as surgeons or physicians.
So, I think when a patient who knows they have migraine syndrome or recurrent headaches, when your headache changes for you and it's not the typical headache that you normally experience, this is when you should be worried. Patients will know when a headache is significantly more severe than what they've routinely been experiencing, and especially when a headache is no longer responding to the same types of medications that they've been taking. If a headache is associated with some numbness and tingling on one side of your body, or it's associated with nausea and vomiting, or any type of confusion. Confusion is not a routine associated symptom with a common tension type of headache or a migraine.
So migraines have nausea and vomiting, but those headaches and those symptoms get better with time. If you have a constant headache, if something's waking you up from sleep, if you're having the worst headache of your life, if you're having severe neck pain or vision loss, those are things that you really do need to see a physician right away. We're happy to answer any other questions at IGEA Brain and Spine. Call us or email us with any questions. Thank you for joining us.
Thank you.